Yes. Aditya Tandon, close the show for us with your concluding remarks on the best way forward as far as this bill is concerned.
I think, Frank, this is a much needed bill, as Dr. Srivastav said, the need of the hour. And for me, the most important takeaway from this bill is that our country is the only country in the world which is extremely dominated by the MBBS profession insofar as prescription rights on drugs are concerned. I've studied models of healthcare delivery across, European countries where health delivery is very fine and high quality. If you look at the UK model, there are around 40 ranges of specialists, nurses, pharmacists who, with certain amounts of certification, can not just prescribe medicines, they can even conduct small procedures. For instance, in the UK, you don't need a surgeon to perform a Botox. You can actually have a trained pharmacist or anybody who can do a certification course can actually administer Botox. But in India, there is this, stranglehold of a certain profession on a range of things. For instance, a nurse with 30 years experience in ICU is legally not permitted in our country to dispense medicine to the patient. That is absurd. That is sought to be changed through this bill. This bill is proposing for the first time a mid-level health cadre, which is a non-MBBS cadre, which can have nurses, it has to be medical fields, nurses, pharmacists and other such professions where you can actually have certified courses and you can train these people not to dispense all kinds of life-saving medicines, but at least to dispense some kind of medicines through the formulation of standard protocols. After all, the government is promising to set up 1.5 lakh wellness centers across villages. Sure. You see, the MBBS doctors are not willing to go and serve in rural areas. Government after government has failed in, incentivizing the MBBS doctors to go to villages and serve.
So we should look for new avenues, and that's what this bill does, is what you're saying.
You can't not go to the villages to serve and not let another cadre also come up.
Right.
You can't have the cake and eat it too. So you have to follow the dialogue process and assimilate your concerns and move forward in the interest of the nation.
Absolutely. So it cannot be a monopoly of certain sections is what you're suggesting. It has to be far more far-reaching. With that, it's a wrap on this edition of The Big Picture. Thank you to all my guests for joining me on the program and putting things into perspective for us. That's it from me. See you again next time.